This month, we celebrate Donate Life Month, honoring all the inspirational donors whose selfless acts have saved countless lives. I'm Hartford HealthCare's Tina Verona, and I'm thrilled to have you join us on this edition of Connect to Healthier Live with the Hartford Current. And of course, I have the absolute pleasure of being joined by Dr. Wasim Dar. He's a transplant surgeon at Hartford Hospital. Welcome. It's so nice to have you in the studio with us.
It's great to be here. Thank you very much.
Of course, and we invite you, as always, to be part of the conversation, and we look forward to you asking your questions in our chat. And Dr. Dar, I want to get right to the chat. We've got a lot of questions coming in, and we're going to go all the way to Marlborough first, where we find Kathy, and she asks, what organs are generally eligible for transplanting? Are there any that are less known? That's an interesting question, Kathy. Thanks for asking it.
Yeah, that is a great question, Kathy. And so, it could be a very long answer, but I'll try to keep it short. So for living donors, people who are alive who donate their organs, generally it's kidneys and a smaller number of livers. Other organs really aren't taken from living donors because of the risks and complications potentially during surgery. For people who've passed away and are organ donors at the time of their death, really almost anything can be donated. The things that we focus on are things like the heart, the lung, the liver, kidneys, the pancreas. A small number of donors can also donate their intestines. And then there are tissue donors as well. So people can donate things like their corneas, skin, even bone, so which gets used in other kinds of surgeries.
And back to kidney donors. So if you're at home and you're thinking about becoming a kidney donor, I think it's important to point out that you can live with one kidney. And the other thing that is, if you ever are in need of a kidney and you have donated previously, you get bumped to the top of the list. Can you explain how that works?
Sure. So to your first point, yes, when we select donors who are going to donate their kidneys, we want to make sure that we're not harming their health long term, in particular their kidney health. So by and large, these are very, very healthy folks who can live with one kidney. That said, we also recognize that there might be some long-term risk with that, 30 or 40 years down the road that we can't anticipate. And so we don't want to disadvantage those folks who've donated. So if it happens that you develop kidney failure after you've donated a kidney, the national organization that regulates organ recipients in the United States basically has said that those folks, when they get listed, will go to the top of the list, meaning they get the highest priority for a kidney transplant once they're on the list, so that they're not disadvantaged in any way having donated.
Right. Important to point out. We're going to go to Unionville, where we find Larry. He asks, what is the procedure and timing regarding the transplant list? Thanks, Larry, for asking.
Yeah, Larry, that's a great question, and it really depends on what organ you're trying to get listed for. So, if it's a kidney transplant, you go through an evaluation at a transplant center. There's a lot of testing involved, heart testing, sometimes lung testing, and depending on what that testing shows and where your kidney function is at, you get put on the list. And the biggest driver of that is how long you're on the list in terms of getting a kidney transplant. But other organs like hearts or lungs or livers, people can be very, very sick, and so that listing is driven by sometimes how sick they are, and then again, same thing, making sure that you're otherwise safe to get through a big operation. So.
Yeah. All right, Marion Canton asks, what tests need to be done to determine eligibility as a possible living donor? And this is a great question, Mary. It's quite a process to go through, and the reason is because you need highly qualified candidates to be able to become donors.
Yeah, that's correct. So I appreciate Mary sending in that question. I'm going to focus on kidney transplantation because that's the vast majority of people who end up being living donors. But yes, you have to have a baseline level of good health. Usually a transplant center will then sort of screen you. Sometimes that screening is done through a website. Sometimes somebody gives you a phone call to make sure you don't have diseases that might affect your kidney, like high blood pressure or diabetes. And then you go through testing, and the testing is pretty rigorous. You get a lot of labs to test your kidney function, make sure there's nothing else we're missing in terms of your health history. You get scans to make sure we can safely remove a kidney. And then also there's a lot of sort of what I would say non-direct medical sort of evaluation, meaning how are you doing as a human being? What's your mental state like? We want to make sure that this is not a stressful event for you long term in your life, right? So it's a lot of stress to go through an operation that you really don't need, and we want to make sure that that's something that you can get through safely, both in terms of your medical health, but really also in terms of your quality of life.
Yeah, I want to talk about it because a lot of folks out there, when they do become donors, they do it for a specific reason, because maybe they want to donate to a friend or a loved one, and sometimes they may not always be the perfect match, but that doesn't still necessarily mean they couldn't donate. Can you explain that process in terms of the kidney chain and the registry, and you can indirectly help the person that you intend to, even if you're not a match?
Yeah, so that's a really great question. When living donation started, I think, as with anything that starts out, people were very conservative. So we, in the transplant community, said, you have to be able to directly donate, meaning you have to be able to give your kidney directly to the person that you intend to. What we've come to now, many, many years later, is we realize that that doesn't have to be the case, that you can benefit from a living donor kidney irrespective of whether you donate to your recipient. Well, how does that work? Like, how do you know who you're going to donate to? So now we have something called an exchange, where you can donate your kidney into the exchange. It's like a bank almost, and that kidney goes to somebody else somewhere else in the country. But at the same time, the person that you wanted to donate to gets like an IOU or a voucher where they can cash it in at the bank, and the bank will give them a kidney back. And that process works extremely well. It's extremely efficient. And more centers are involved in those exchanges. Hartford Hospital happens to be one of the most prominent hospitals that's involved in the exchange, and probably in the Northeast, we're probably the most aggressive center when it comes to facilitating exchanges, so we can help patients who may not have that opportunity to directly donate.
And those exchanges lead to kidney chains that have been very lengthy, and specifically at Hartford Hospital, we have had some lengthy chain reactions, if you will, that just starts from one donor and it just goes everywhere. It has a lot of tentacles.
It does. So you can think of it as something that is like a ripple in a pond. So you throw a stone in, and that ripple goes out way out in the pond, and that's kind of the good that can happen from a chain. You can basically donate your kidney. It goes to one intended recipient. That person has someone who's donated on their behalf. That goes to another recipient, and in theory, that chain could go on for a long, long time. I think the record might be 13. I don't know if it was at Hartford Hospital, but we have participated in some long chains.
Yeah, it's really incredible. Brian in East Windsor asks, what tests are usually done prior to transplanting to determine risks, and what tests are done post-surgery to ensure the organ has been accepted? That's a good question, because sometimes you can hear of the body rejecting the organ.
Yeah. So the testing that's done both for living and for people who've passed away and donated is pretty similar. So what we're trying to do is, one, we're trying to make sure that the organs, whatever organs are donated, are of the highest quality. So, or that they're going to, in a better way, they're going to work properly in the person who receives them. So for things like a kidney, you want to make sure that the kidney function is good before the donor donates their kidney. Sometimes that's done through lab tests, sometimes that's done through imaging. We also make sure that we're not transmitting anything unusual in terms of diseases from a donor to a recipient, so they get a lot of infectious disease testing. And then to your question, we also do, every donor gets matching done, or typing, to see what kind of immune profile they have, so that we're not giving or transplanting organs that might result in a higher risk of rejection. So all of that is pretty extensive and is done, like I said, for both sets of donors. And that information is really important for us to be able to safely transplant folks.
All right. David in Cromwell asks, how long is someone typically in the hospital after receiving a donated organ? And then even for somebody who is donated, how long are they in the hospital too?
So again, really good question. It depends on the organ that you receive. So for some organ transplants, like again, liver or kidney or heart, that can be a fair amount of time in the hospital, because those patients can be more ill before they receive a transplant. For kidney transplant recipients, typically it's about 3 to 5 days in the hospital. For a donor, again, I'll focus on kidney donors because those are the most common. It's probably about 2 or 3 days in the hospital, and then occasionally, if you encounter a liver donor, it might be a little bit longer, like 5 to 7 days.
All right. Joanna in Granby asks, what is the age limit to be a living donor? That's a really great question. Thanks for asking that, Joanna.
It is a great question because we're always reshaping our idea of what that means.
Right.
So I think, again, if we think about living kidney donation at the start of the process, people were very conservative, and so anybody over the age of 50 probably wasn't considered a donor. Now we're considering people in their 70s as donors. So I would say, most donors fall into the age range of around 30 to 50, and then there are smaller numbers on either side of that, either very young, much younger donors or much older donors. But there's really no specific age limit that we've set.
Does genetic testing come into play here in terms of if you want to become an altruistic living donor? Does that come into play in terms of, or does it depend on the organ? Kidney, does that come into play?
Yeah, it does, depending on the person who's donating and their intended recipient. So for example, there are some diseases, kidney diseases, that can be genetically inherited. So we always want to make sure, let's say if a family member wants to donate on behalf of their family member who has a genetic disease, we'll do genetic testing to make sure that they're not at risk before we move forward. So we selectively use it. More common in probably kidney donation than in living liver donation. For the other organs, really, like heart or lung or intestine, really not a consideration because there aren't really that many. There really isn't an opportunity to be a living donor. So.
Yeah. And if you're out there thinking that you may want to become a donor and are looking for more information on that, I think the Hartford Hospital Transplant Program really does a great job in spelling it all out in terms of the transplant coordinators that you have on the team. It's highly specialized, it's very coordinated, it's multidisciplinary, and there's this whole team that sort of comes together, whether you're a recipient or a donor, but especially the donor. And those transplant coordinators and nurse navigators are very key to keeping this going. Can you talk a little bit about the multidisciplinary approach?
So that's a really important word in transplantation. We could not do this without a team. So I'm here as a surgeon, and presumably I'm doing the surgery. But the reality is, without a coordinator to help guide a patient through the evaluation process, whether as a recipient or as a donor, without their sort of continued support of the patient and their family, patients would have an almost impossible time getting on the list, and then we would not have we would not have the ability to support them post-transplant, because you can imagine if one person is both doing the surgery and then also having to follow up with the patient about how they're doing in their recovery, whether they have their medicines, it becomes an enormous task, and you really need dedicated, committed people to be a part of a team that looks at the whole patient, and that's where coordinators are critical, along with all the other members of the team, like dietitians, social workers, our MAs in our office, really everybody.
And you use words like dedication, commitment, teamwork, and all of that's important because that's what led to the Hartford Hospital Transplant Program being nationally recognized for graft survival rates and so forth. Can you talk a little bit about that?
Yeah, so we were, again, this is a reflection of, I think, the teamwork that's here at Hartford Hospital. We were in, I believe, in 2023. If you look at how well patients did after a kidney transplant after 1 year, we were the best hospital in the nation in that metric or that measurement, meaning our patients did the best with their kidney function and their kidney organs after 1 year. And then recently we were honored by the Connecticut Hospital Association with the John D. Thompson Award for Quality of Care using data or information, meaning that we were recognized for being very good or the best last year at using information that we get from our patients and our surgeries to help improve patient survival. So I feel like Hartford HealthCare really is out there on the map in terms of its quality outcomes and how well patients do.
Yeah, it's so important. And just as we wrap up, Dr. Dar, can you just, if somebody out there is watching and thinking about becoming a donor, what advice or what would you say to those folks?
So one, become a donor. It's you're demonstrating generosity, that really can't be measured. It's easy to become a donor. There are many ways to register as a donor. The easiest, I think, is through the Department of Motor Vehicles when you either renew your license or renew your registration. If you're interested in being a living donor, Hartford HealthCare, our transplant website, I believe, has a small screening tool that you can access on the web, and then somebody may give you a call to see if there are further steps you can take to potentially becoming specifically a living kidney donor. And there are then also national resources for living donation, particularly living kidney donation through the National Kidney Foundation or through the National Kidney Registry, which are also available through the web.
Dr. Wasim Dar, transplant surgeon at Hartford Hospital, thank you so much for joining us today. We appreciate it.
Thank you very much. I appreciate the opportunity.
Of course, and as always, we thank you for watching. For more information, just simply visit hartfordhealthcare.org/transplant. We hope you got something out of today's discussion. I know I sure did. Thank you, Dr. Dar, and we'll see you back here next time. But for now, as always, be well.